Greetings, KSB family. So as we are all aware, we are in the midst of a pandemic, and it is an infection that spreads exponentially from person to person. And I would just like to make 3 or 4 points about the use of face coverings or masks, which has become kind of a new part of our daily wardrobe. So the first point I'd make is it is really the easiest thing we can all do to protect each other. It's pretty simple. Universal masking is an intervention that we think can save 20, 30,000 lives across the US. And we're all used to thinking of things by weighing risks versus benefits, right? So the risk for the vast majority of us in wearing a mask is negligible. Whereas the benefits are potentially huge. There may be not a lot of benefit, but there could be huge benefit. And with the risk being negligible, it's kind of a no-brainer. So wearing masks can help save lives, and the other thing that it can do is help get us all back as close to some semblance of normalcy sooner rather than later. So the sooner we can make progress on reducing the transmission of this, the sooner we can get the U.S. back to normal life. So the next point I'd like to make is that, as our governor recently said, if we're not doing it, we're endangering those around us. So I think we really have a civic duty to do this, and as KSB employees, I think we have an obligation to set an example for our community. So another point is that if we're going to wear masks, we got to do it correctly. So it's got to be on the nose and mouth. We see a lot of variations of that out in the community, and I think we should be the ones setting the example for that. So if you're going to wear your mask, make sure it's covering your nose and mouth and that you have it on whenever you're within 6 feet of others. So then my last point is really, when should we be wearing a mask? And honestly, I've started to think about it as when should we not be wearing a mask, because I think it's a little easier to think of it that way. It's become such a normal part of our wardrobe, and I think it needs to be right now. And so I think the times when we don't need to wear a mask are basically when you're in your own home or on your own property around the people that you live with. Possibly in your car too, if you're just with your own people from your own household or you're by yourself. Probably not needed. Really, any other circumstance, I think even outside, the risk of transmission is probably much lower outside, but if you're sitting somewhere for an hour or two with someone else close by on a fairly calm evening, not much wind blowing, honestly, I think we ought to be wearing masks if we want to do the best we can to minimize the transmission of this. So unless you're at home on your own property and with the people that you live with, you really ought to think about having a mask on in all other circumstances. So thank you for listening. Together we can all get through this, and we appreciate all the work everyone is doing to help move our hospital and our community forward. Thanks, everybody.